A proposed law would allow out-of-state nurses to work here in Massachusetts. 22 News State House reporter Christine Lee standing by in Boston to tell us how that could affect the care you receive at the hospital.
Advancing technology that allows nurses to give medical advice online or over the phone. Some healthcare providers want to introduce multi-state nurse licenses to Massachusetts. But opponents of that idea say multi-state licenses reduce the quality of care. Hospitals and nurses are supporting legislation that would allow out-of-state licensed nurses to work in Massachusetts. So far, 24 states, including New Hampshire, Maine, and Rhode Island, are part of this nurse licensure compact.
This provides opportunities for nurses as well as patients to expand the available pool of qualified nurses to render health care in our country.
But the Massachusetts Nurses Association says Massachusetts has a higher standard than other states to practice nursing, such as continuing education requirements. They say joining this nurse compact would diminish the level of care in the Commonwealth.
We're very concerned about the dumbing down, if you will, or the lowest common denominator approach to nurses, where there's one license, anyone can come in from Nevada or Florida or Maine or whatever. Hospitals and other nurse groups say a multi-state license would let nurses offer medical advice to out-of-state patients over the phone or help states during times of disaster when they're needed in a short period of time.
Patients in New York could be coming to Bay State Medical Center for care, actually.
Which means that a nurse would be required to buy one more expensive license in order to practice in a number of different states.
Supporters of this bill say they eventually want to pass federal legislation that will allow nurses to apply for a multi-state license and work anywhere in the country. Live at the State House, Christine Lee, 22 News.